angina. Angina is a chest pain or discomfort in the body. It happens when the heart does not get oxygen-rich blood. Heart does not get oxygen-rich blood due to the blockage of one or more coronary arteries. The blockage happens due to the plaques or the cholesterol levels in the arteries. Angina is a symptom, it is not a disease. There are types of angina such as like stable angina. Stable angina, in this the heart needs more oxygenated blood during the stage of climbing, exercise or emotional damage. It needs more oxygenated blood and need more oxygen. So there is an unstable angina. Unstable angina is a position where the patient is in a rest condition and the body needs more blood and the sudden attack counts. Okay, sudden attacks counts called in the emergency and there is an emergency treatment needed. So the treatment involves the cardiac catheterization and the angioplasty is performed. So if the angina lasts more than 20 minutes, then it will be converted into the myocardial infarction and the death. There are presmental angina or rest angina, so it can be countered by the nitroglycerins or the rest or the calcium channel blockers. Nitroglycerin are presmental angina or the rest angina, so can be countered by the nitroglycerins or calcium channel blockers. There are the treatment of stable angina. Stable angina can involve the beta blockers, and the secondly there involve calcium channel blockers, and the thirdly there are organic nitrates, and the fourth ones are sodium channel blockers or sodium channel blockers that are in ranolazines. So in angina we can counter the patient in the emergency by the nitroglycerins and the other cardiac catheterization treatments. Thank you.